Welcome, everyone. You'll notice that we did start the recording. I don't share the recording. It's just for me to take notes and send them out afterwards. We haven't done it the last couple meetings because we had some sensitive legal information that was going on. I spoke to Esther Reyes, who's going to be speaking today about some of the federal policy changes that are taking place, and she's okay with us recording it for that purpose. So we will go on. Welcome, everybody. Let's give folks a few more minutes to join up. What we have been doing recently is rather than doing introductions here in the with a larger group, because we've been luckily having larger groups come up, we just do our introductions when we go into breakouts. So if you haven't joined us before, the first thing that we do is relationship building or breakouts. So we'll be going into other rooms in that shortly to do that. I am going to actually put in, we've got lots of people jumping on now. Welcome, everyone. Please actually go ahead and put your introductions and your contact information if you want to share it in the chat. I'm also going to ask, I'm going to put in here, as I will probably a couple more times, the link to the survey. You might want to open that up so that you have it, so that when we're done, you can remember to do our feedback survey so that you can provide some feedback so we can improve. Hope everyone's doing well today. Again, what I was just saying is if everyone can put their introductions into the chat, we're also going to do introductions when we go into our breakouts during our relationship building exercise. Awesome. Thank you, everyone, and welcome, everybody. Got 22 people so far. Probably a few more will be coming in. One of the other things, actually, I do use the chat an awful lot. So if you put questions in there, I'll try to keep an eye on it so we can ask questions. We'll ask Esther Reyes, who's with the Protecting Immigrant Families, how she wants to handle it during the second section. But whether she wants to handle questions as we go through or wait until the end. But somebody remind me to ask her that. I don't think she's joined us yet. Welcome, everybody. We've had a few more people join us. Please put your introductions into the chat. I do use the chat quite heavily, so feel free to put comments in there. The other thing to put into the comments is any updates that you have. We will try to have updates at the end. It depends on how many questions people have for the Protecting Immigrant Families person. But if you could put any events, any flyers, anything like that into the chat, that would be great. Campaigns that you folks are working on, anything along those lines, just because some people leave early. So keep that in mind. Some people leave early. So that's why we want folks to put in their contact information and introduce themselves in the chat, but then also put in any updates that you have from your organization. I've got a couple of requests for Otter.ai note takers. I've just been declining those because I'm going to be recording. I am recording this. I don't share the recording. Again, I just use this to take notes, and I apologize for the tardiness of the last set of notes, but we have had some different issues going on over the last few months with a lot of very sensitive legal issues. So,
so you are going to send out notes?
Follow, yes.
Okay.
So the relationship builder that I have for us today, well, and actually that's a good question. The contact, hold on one second, sorry. The contact information that I put into the chat, I don't distribute that after the fact. If someone were to request the actual chat stuff, then on a case-by-case situation, I could probably send that out. But because of sensitive environment that we've been in recently. Um, I haven't been sharing specific contact information, if that makes sense. So, welcome everyone. For those of you that are new, we do our introductions, our personal verbal introductions in our breakouts, which we're going to go into in a second. I just put into the chat the topic, and you guys are all quite um, liable to talk about whatever you want, anyways. But this is something to maybe get you going. In this time when many of us feel unsafe or under pressure, what helps you hold on to strength and hope, and what support do you most need from others here to help feel less alone? Um, Kind of touchy feely, but maybe one of the things is just to take out of that. What do we need from others, right? So I'm going to break us out. Please introduce yourselves, and if you could pick somebody in your group to give us some feedback, to report back on what your group basically spoke about, that would be great. Um, does anyone have any questions before I send us into our breakout groups? Going once? Awesome. Well, thank you. And again, we're going to have Esther Reyes, who is with Protecting Immigrant Families, doing our informational presentation at about 9:40. So we're going to go for 20 minutes and then come back, do a little bit of a recap on what our discussions were about, and then move on to our informational, and then we will go to our mutual updates. All right. So breakout rooms. All right, I'm going to create 9 breakout rooms. Thank you, everybody. And again, please introduce yourselves in your rooms. I will put the topic back into the chat again, but also basically, what do you need from others is kind of a simplification of it. And I will see you folks in 20 minutes. Thank you. Hi, John. Everyone's in breakout rooms. Our our topic of conversation is going to be in this time when many of us feel unsafe or under pressure, what helps you hold on to strength and hope, and what support do you most need from others here to feel less alone? Kind of simplified it down like, what kind of help do you folks need from others? Though I often find that everybody, who knows what people are going to actually talk about in their breakout rooms. So I hope you're doing well. Good to see you. And I'm going to assign you to, there was one room that had somehow a meeting AI note taker got stuck in. So I'm going to stick you into that room, and then there'll be 3 people in that room. Thanks, John. Hi, Taylor.
Hi, David. How are you?
Very good. How are you?
Good.
We are all out in breakout rooms. People are
Oh,
discussing what they need from others, or more specifically, what they need from others in this current time of pressure, etc. What helps to hold on to strength and hope, and what support do you most need from others to feel less alone? So I'm going to
absolutely.
go ahead and put you into one of
Okay.
the breakout rooms. Just introduce yourselves and remind them to pick somebody to give us some feedback at
Okay,
the end
sounds
to
good.
report back.
Okay, thank
Thank
you
you.
so much.
Hi, is that Dell?
Yes, this
Dell?
is Dave.
Oh, hi, Dell. So we are actually out in breakout rooms. We're talking about what we need from others, or more specifically during these stressful times, what we need from others to feel less alone. I'm going to go ahead and assign you to a room. Just introduce yourselves and remind folks that they need to have somebody give us a report back at the end. It's going to be about 18 minutes.
Okay. Actually, I wanted to get in to listen, but I'm actually preoccupied with something right here. Um,
Okay.
so I might prefer just waiting.
All right. Actually, I think I already sent you into a room, but if you don't
Okay.
go, that I guess works too. Hi, Dawn. Hi, Don. We're
Hi,
already
sorry, I
out.
was having technical difficulty,
All
but
right,
I missed something.
that's my life. We are all out in breakout rooms.
Oh,
I'll assign you to a room. We're saying in this time when many of us feel unsafe or under pressure, what helps you hold on to strength and hope, and what support do you most need from others to feel less alone? I'll simplify that to just what do you need from others. But I'm going to go ahead and
okay.
assign you to another room.
Thank you.
And Chandra, can you hear us?
I can. Can you hear me?
Hi. Yeah, and Telmira, if I said that right. Telmira, so we have folks out in uh, meeting rooms. So I'm going to go ahead and assign you to folks to meeting rooms. If you could just introduce yourselves, we're talking about what we need from others in order to feel less alone. Um, so I'm going to go ahead and assign you, and just remind folks that we need people to report back on what you guys talked about at the end. So thanks so much, and I will send you out. Hold on. There we go. Hi, Wanda. We have folks are out in, I don't know if you can hear me.
Yes, I can.
Oh, good.
Sorry,
Um,
I'm late.
that's all right. We have a little less than 10 minutes left. I'm going to put you into one of our breakout rooms. Folks are discussing what we need from others, basically, in order to hold on to strength and hope, what support you need most from others in order to feel less alone. Uh, just go ahead and introduce yourself, sorry. And
Okay.
we have, like I said, about 9 minutes left. So let me put you into a room.
Okay.
Thank you.
Thank-
Hi, Cam. Cam,
Hi,
we are
sorry
in,
I was running late. We had something going on at the office here.
that's always the way. We are in breakout rooms. People are discussing what they need from others in order to feel safe, or basically what we need from others during these stressful times. I'm going to send you into one of our breakout rooms. We have about 8 minutes left. If you could
Okay.
just introduce yourself and see if you can catch the gist of what we're talking about, that would be great.
All right, sounds good. Thank you.
Thank you. Hi, Cindy. Can you hear us? Cindy? Cindy, I can't hear you. I'm going to assign you to one of our breakout rooms. We're discussing what we need from others in order to feel safe during these stressful times, more or less. Just introduce yourself when you get into a breakout room. And we have about 6 minutes left. So I will go ahead and put you into a room. Thank you. Oop, did you go? You might have to click on something. Where's it not going? There we go. Hey, Gianna.
Hi, David.
Hey, we're in breakout rooms. We got about 5 minutes left. They're discussing what we need from others in order to feel less alone and to help us in these stressful times, more or less, is the question. And if you could just introduce yourself, I'll go ahead and stick you in a room for a second.
Okay, thank you.
Hey, Jess, can you hear me? We have like 4 minutes left. People are in breakout rooms.
Oh,
Uh,
got it. Hey,
do you want
sorry,
to?
I was.
That's all right. I can stick you in a breakout room if you'd like. They are discussing what we need from others during this stressful time in order to feel safe, etc. Um, like,
It's a good
like,
topic.
yes, like I said, we've got 3 minutes, so maybe you can get
Yeah.
hopefully remind them that they need to do an update. So I'll stick you in a room if you can.
Oh, no, no, no,
It,
no. No,
no,
I don't want to distract them because it's
okay.
such a short time. So I'll just sit here quietly until
All
everyone
right.
gets back.
How are you doing?
Oh, I'm fine.
Yes, with everything that's going on, and you've got the multicultural fest coming up.
Yeah, it's kind of terrifying. I'm a little bit sick to my stomach right now. I was feeling good, and
Uh-huh.
the shooting happened yesterday, and yeah,
Oh yeah, you didn't even think
not
about
feeling
that
so
for
good
these
today
events.
about it.
Yep.
Yeah, yep, it's terrifying. How about you? How are you doing?
Just continue to feel like I'm, going through life, walking into against the fire hose in my face.
Yeah.
Um, it is, and a lot of it is stuff I can't even do too much about. But hey, Rita, we only have like 2 more minutes. People are out in breakout rooms, so I don't know. If, we're actually talking to Jessica right now. It's funny, I got the two of you from the multicultural festivals.
Yeah. Hi, Rita. How are you?
Good morning. I'm good. How you doing?
You know,
Living the
your
dream.
yeah, your event is this weekend.
Yes,
How are
yes.
you feeling?
Oh, that's not a question that you do the
I
week.
know. I know. Gosh.
Actually, I'm surprisingly not stressed,
Oh, good.
but like very excited for the new
Good.
hybrid model, and it's just very excited that this is happening. I'm blessed that we're doing this. So
Good.
yeah,
That's great.
yeah.
That is awesome. Oh boy.
Taking the opportunity to push out the information, and I think I'm gonna put in the group chat a flyer for people to like push out the information and let everybody know.
Please do. I'm not sure. You might want to wait until people come back from the breakout. I'm not sure whether they see it if we're in the breakout when you put it in. Um, I can never figure out how Zoom works on these things, and then they
Yeah,
change.
sounds good.
Um,
I'll wait.
no problem.
What are we doing in the breakout?
They are discussing in this time when many of us feel unsafe or under pressure, what helps you hold on to strength and hope, and what support do you most need from others here to feel less alone. Um,
Jessica, what is the support that you most need this time?
Oh, we kind of created our own little group here. Actually, I think that, what we started doing with, our multicultural festival um, group, I think was super helpful. And, um, I really appreciate that support from outside of my own community. So being able to connect with you two and talk about our festivals and our plans and our fears and
right.
challenges has been really helpful. So yeah. How
Nice.
about how about you?
I think it's mostly the spread the word, like let people know this is happening and why is more important than ever to support this type of events.
Oh yeah.
And yeah, I think it's mainly the acceptance and the and letting people know that cultures matter, especially on these hard times. We all woke up with sad news from yesterday, so I think we are in very challenging times, and all these subjects matter,
Mhm.
especially today.
Agreed.
Awesome. Well, people are going to start coming back in now. Letizia is here. Um, one of the things Jessica and I were just saying before you came back in was now how is this shooting going to affect events?
Yeah.
Yeah.
Yeah, it doesn't sound good.
Oh, Myra, hello, Leticia. Good morning, everybody.
Good morning, everyone. Welcome back.
Hey.
So nice to see everybody. Shirley, hello.
Hello. Hi.
Hi.
We never have enough time in our breakout groups. I'm just going to say that out loud, David.
Well, thank you, Deborah. That is actually good to hear, and you're not the first person to say that. Every once in a blue moon, you get the reverse, but mostly people want more of this time, so we'll see.
And we know who wants less, but that's okay. I manage.
So welcome back, everyone. I don't know why these are not, oh, maybe they're all closed. Sorry, my breakout rooms was still open, so I assume people were still in them. Is everybody back, I believe? Thank you, everyone. Just a couple things is, again, we have a recording going. It is actually, oops, sorry, I'm trying to multitask here. I'm not going to be sending out the recording. It's just for my own notes, so please don't worry about that. If we do use the chat heavily, please put your information and any updates because some people leave early. So please try to take good advantage of the chat notes. I'm also going to put in again our survey link. So please complete our survey link. You can, if you click on it and just open it up, and then you can finish it when we're done. That would be awesome. Let's go ahead and see, does anybody here want to volunteer to talk about what you folks discussed in your groups?
Dude, I don't mind getting started.
Awesome.
So we had myself, we had John, we had Shirley, and we also had Cindy in our group. So two community or cultural organizations and two service level organizations. And we all kind of shared a similar theme of community. Cindy shared an important point about being with family and our loved ones and being with people surrounded that uplift us. Shirley also shared a similar sentiment about being in community, and John as well. So just being around people that we appreciate, getting a coffee, a tea, and just taking some time to build relationships and sort of recognize some gaps in several industries or other industries that, due to funding, may not be there anymore. So how can we collaborate, partner, and bridge a gap?
Awesome. That is fabulous. So thank you so much. Comments? Next.
So our group, which was Cam and Patricia and Nancy, I will quote Nancy, being around people of like mind who are active, not just complaining. And that's it.
That is hard. But thank you, David. That's true. I guess what I meant by hard was sometimes I observe what's going on, and I guess that is complaining, though. That's what my partner tells me, anyways. Linda, I see your hand up.
So our group was Tracy and Kathy Kitchell and myself, and we primarily talked about what's going on with the kids because we had Kathy in the group, but Tracy's going to be talking a little bit later about some initiatives they're taking in the state about providing support to our immigrant and refugee families. So that was good to hear that there's some things coming up, and he's going to talk about that during sharing time. I think one of the things is that with the three people we had in the group, it's primarily we're lucky that we have groups like this and the Equity Task Force and the Concord Area Providers that Patricia does, and all these things that we have a chance to connect with each other. But there are people out there that don't have that, and so it's about working together to find that and develop that for people. Thank you, David.
That is awesome, Linda. And it makes me realize too that so many times when I'm trying to do an event or talk about a group or a project or something, and I meet someone that is like, oh, I had no idea that was going on. Now this person is in that realm. So I talk too much anyways, but I'm always trying to tell people about these things that are going on so we can make these connections. So maybe if everybody thinks a little bit about sharing the information that we know and these resources that we have, that would really be great. That's a great point, Linda. Thank you. Anybody else? Mary, sorry.
Marie. My group was with Martha, Sue, and Wanda, and the theme of community did come up as well, that need to build community, have safe, trusted people that you can go to. And then we did briefly also talk about sort of the need to balance self-care and for some people who feel charged by opportunities to help, or like how do you balance that and then looking for things to do to get that sense of purpose, um, especially when the issues are so large, and you might otherwise feel helpless. Again, it's kind of a two-part where you have people in the community who don't feel safe, um, they don't know where to go, they don't know who to trust, and then you also have people on the other end who are thinking, how do we help? What's most needed? So how do you bridge that gap? How do you have identify and work with those allies to be able to connect both sides?
Absolutely. Thank you. Any thoughts? Any thoughts on any of the people that went before? Awesome. Anybody else? Ileana?
Good morning, everyone. So in my group, there was myself, Leticia, Barbara, and Taylor. And pretty much to sum up of what we spoke about is the level of support from our allies and from our community in general, and just the volunteer level. So just the amount of people that we see to increase of volunteers, of support from the community. Um, it's really something that has pretty much has brought us together.
Awesome. Thank you. And then hopefully when we do the updates, Ileana, you can talk about what GSOP and other groups are doing around the rapid response, the canvassing, the courthouse watch, etc. Anybody else? I lost track here. Awesome. Well, again, I think the big thing is
David, there's Carolyn Gordon. She had her hand up.
Oh, Carolyn, sorry, I couldn't see you.
Our group consisted of Tamara, Cora, and Donna, and very similar to what others have shared, the sense of working together with like-minded people, all the organizations represented here, that also help give people agency, mention the value of allyship training, and also the value of festivals, like the one in Nashua, that really bring people together, and that they're now being also offered in hybrid mode so that people that are afraid to come out can still join.
Awesome. Thank you. And it is interesting. We've got folks from both the Nashua Multicultural Festival and the Concord Multicultural Festival today. And they're actually, Nashua has gone to a hybrid or more virtual mode, and Concord is going to continue as it is. So it's interesting. We have formed a group, actually, in case you didn't know, of all of the folks that are organizing these multicultural festivals. And it has been interesting. It started actually last year before a lot of this came down the road. But it is interesting with the current atmosphere. The conversations that we've had have been amazing. Anyone else? Awesome. Well, thank you all for all of that. Again, I would like to, we'll switch over now to our informational session. And we have Esther Reyes from Protecting Immigrant Families. I will let Esther introduce herself, but I would like to ask Esther, do you want to take questions as you go through, or do you want to save them for a Q&A at the end?
I think it would be helpful to wait until the end, so I don't get off track.
Okie dokie. And Did I give you make a co-host? Here we go. Confirm.
Okay.
So you should have all the powers that I can give you.
Yeah. Okay, let me see if I can do this successfully also. Oh, I don't have. Oh, wait, yes. Here we go. Now this will be over here. This. Okay, what are you all seeing?
Cruel Summer, White House and Congress for Immigrant Families.
Okay, great. That's what I want you to see. Okay, well, thank you so much, David, for the opportunity to be here. And hello, everybody. My name is Esther Reyes. And as David mentioned, I'm here with the Protecting Immigrant Families Coalition. Um, and I am a campaign strategist. I work with our team and our partners across the country to coordinate efforts to push back against restrictions, eligibility restrictions for immigrant access to public benefits, and also to expand access to public benefits. Um, we've been referring to the summer as the cruel summer because along with many of the um, non-immigrant related things that have happened, a lot of things have come down that have really put immigrant families, in a state of insecurity and fear and instability. And so it's been pretty cruel for our families and our communities, and also for advocates who are, uh, you know, understanding what this is going to mean and sharing this information. So thanks again for the opportunity. Here's my plan for today. So I'm going to talk a little bit about who PIF is, so you all can get an idea um, of the work that we do and who our partners are. Then I'm going to talk a little bit about the context of how the safety net has been restructured and vastly reduced. Then I'll talk specifically about the overview of changes to immigrant eligibility in federal benefits, including healthcare, food, and tax programs. And then I'll talk about how we move forward, because we have a big responsibility ahead of us. And, we're working together as a coalition to respond collectively and strongly. Okay, so who are we? So the Protecting Immigrant Families Coalition, we go by PIF often, came together in 2017 as a response to the first Trump administration's leaked public charge rule. At that point, PIF started organizing partners across the country to engage them in a comment campaign that really slowed the rulemaking process for the Trump public charge rule. And then after that, it was a really significant pushback because the original leaked version of the public charge rule that was going to be proposed was much more restrictive than what ended up being proposed or being um, approved. Then after that, the coalition, once the Biden administration came in, strengthened, wanted to push back and undo the Trump public charge rule and reinstate a long-standing policy that had been used as guidance for a long time, for I think 40 years or something like that, 30 years maybe, around that. After that, it introduced the Lift the Bar Act, which I won't go into the details, but that's really about expanding access to people who are here lawfully to a number of healthcare benefits. Since then, we've engaged in a number of multi-issue campaigns and initiatives to really equip and build capacity of our partners across the country. And we have now this is actually a little bit outdated. We now have over 800 active member organizations across the country. So we grew really from just a couple dozen or a dozen organizations to now over 800. Um, and we work together through a variety of campaigns, and we have working groups. I'll talk about that a little bit more at the end of this presentation. All right, now let's talk about how the safety net has really just been reduced and restructured. So Republicans came in, right, with a mandate to cut government spending and taxes, or rather, yes, both spending and taxes. And that combined with an anti-immigrant, very intense anti-immigrant sentiment resulted in policy changes that really have harmed immigrant families and will continue to harm immigrant families. And so we're going to talk throughout this presentations about two main ways that policies have been changed. And one is through Congress, and the other one is through the administration. And so Congress, through H.R. 1, used a process known as reconciliation, which makes it easier for a party to pass legislation to push through really unpopular cuts and to increase drastically spending on immigration enforcement. So what this did was not just radically reduce the safety net. It also provided tax breaks, mostly for the wealthy, and then again provided for a dramatic increase in immigrant detention and also interior immigration enforcement. And then the administration, which is includes the White House and the executive branch, have been chipping away at the availability and the security of programs and really trying to reduce immigrant eligibility wherever they can. And one example is that executive orders and agencies' notices have reinterpreted longstanding policies to exclude people from being eligible for certain benefits, even if they're here with a lawfully present status. They've also really started sharing data, though that has been, advocates and states have expressed the concerns about data privacy. So those have been, some examples of just not just how much harm, or how much harm they want to cause immigrant families, but also just trying to be showy, right? It's like, let's just go after everything and scare immigrant families and immigrant communities and really affect their participation in all aspects of public life, whether it's schools or churches, or health clinics, etc. So I'm going to talk about major policy changes to several programs. As I mentioned before, there are cuts to major programs in general, including major cuts to funding for Medicaid and SNAP, which will cause states to reduce coverage and support people with low incomes. And there's been changes like work requirements that apply to everybody and will make it harder for qualified people to get the care that they need. And then there's specific changes to eligibility by immigration statuses. And so I'll talk about how Congress has taken many programs through H.R. 1 and reduced who can qualify for those programs. And the White House has decided that more programs require immigration restrictions. Okay, so now let's go into specific changes to immigrant eligibility for federal benefits. Okay, so what you see here on the slide, H.R. 1 is the OBBBA Act that was passed this summer by Congress. And I'm going to talk a little bit first about healthcare and the changes in immigrant eligibility for various healthcare programs. So we'll start off with Medicaid and CHIP. So starting in October of next year, federal Medicaid and CHIP will exclude many lawfully present immigrants. The only ones who will remain available are at the bottom square here, and that includes lawfully permanent resident adults or green card holders who have met the 5-year waiting period. As some of you may or may not know, if somebody is here with a lawful permanent resident status, they still have to wait 5 years to access any sort of benefit. Another group that will remain eligible are Cubans or Haitian entrants, migrants who are part of the Compact of Free Association, and in some states, lawfully residing children and pregnant people that opt into coverage for them. Right here, I'm listing who will still be eligible. On the next slide, I'm going to show you all the people who will no longer be eligible. So just hang on with me for a second. Then for Medicaid, again, lawfully present immigrants who do not fall under any of these categories below will no longer be eligible to newly enroll into Medicare. And by January of 2027, lawfully present immigrants who, again, are outside of these categories will lose coverage. So that's Medicaid, CHIP, and Medicare. We move on to Marketplace. So starting in January of next year, many immigrants, again, outside of those statuses listed below, but who have other lawful statuses, will no longer qualify for what are known as premium tax credits that gives them, that provides assistance in purchasing marketplace coverage. So the people not included in that square below will still be able to purchase full price marketplace plans, but functionally, really, it's entirely excluded them because it's unaffordable. And so again, the ones who will still be able to qualify are lawful permanent residents, Cubans or Haitian entrants, and COFA migrants. So here's the kind of like both who will continue to qualify for these programs and who will not. As you can see here, there are a number of lawful present statuses that people can have that no longer will qualify for or be eligible to receive some of these services that had qualified previously. So previously, one of the groups I would say that took really the biggest hit is humanitarian immigrants. So people who have not just come here as refugees or have been granted asylum or withholding of deportation or removal. Previously, those folks were eligible for many of these programs. Also, people granted parole, certain immigrants who had been abused, their children and or their parents, certain survivors of trafficking. These groups who are especially vulnerable will no longer be eligible for these programs. And as a reminder, all of those statuses now that you see the line go through, those are people who have lawful permanent status or lawful permanent, not permanent, some sort of lawful immigration status in this country. So what we see again is a significant rollback of protections for humanitarian populations who often rely on these programs during periods of transition and recovery. Okay, now we're going to talk a little bit more about the marketplace eligibility changes. So effective now, DACA recipients or people who qualify under deferred action for childhood arrivals will be locked out from buying marketplace coverage. So last year we had one access for this group to purchase marketplace coverage. That only lasted less than a year, and now they will no longer be able to purchase this coverage. And again, DACA recipients are here. What their status allows them is deferred action, meaning that they can't be deported while they have that status. And then starting next year, this gets a little confusing, but people, lawfully present immigrants who are not eligible for Medicaid because of their immigration status and who are also earn less than 100, their income puts them at less than 100% of the federal poverty level, they will no longer be eligible for premium tax credits to help buy marketplace coverage. So this is what I mentioned earlier, is that this group of people will be able to still purchase full price plans, but at a much higher cost and will be unaffordable. And then there's also there were also changes in how states will receive matches for providing coverage to certain folks. So states that have expanded Medicaid under the Affordable Care Act will, and those are the ones in blue, including DC, will receive a lower FMAP, or what's referred to as an FMAP or federal match for actually providing services that they're legally required to provide. So federal law requires that that hospitals provide a certain like emergency services where the situation is life-threatening. But if you're in a state that expanded Medicaid, they're punishing these states, and they're going to provide a lower federal match for that. And then they will continue to receive the same rate for traditional Medicaid groups. Okay, so all of that I just talked about were actions of Congress, right, through HR 1 or the OBBBA. Now we're going to I'm going to briefly cover healthcare changes in healthcare programs and eligibility through administrative actions or regulatory changes. So recently, HHS, or the Department of Health and Human Services, issued a notice on federal public benefits that essentially reinterpreted what was considered as a public benefit under PRORA. PRORA, which was a 1996 law that also was passed through reconciliation and also radically restructured safety net programs and eligibility, lists, I'm going to try not to get too much in the weeds because it can get confusing, but what the administration did through this notice is say, we are now using this definition of public benefits under PRORA. We are now going to add more programs that exclude people who previously were qualified for these programs as qualified immigrants under that 1996 law. So this notice added those programs. It did not change eligibility for Medicaid or CHIP, and it reiterated legal exemptions for nonprofits, but lists many programs that they administer as public benefits. So I think the shortest and maybe clearest way to say this is that they added more programs to the list of what are considered public benefits, and stated that these public benefits are only restricted to certain groups of immigrants, even though they fall under a qualified immigrant status under the 1996 law. So I know that's a lot and it gets confusing, but there is an explainer that I have linked here, and I will be sharing these slides that gives you more information about what this notice did and what it means. Now, just hot off the press this morning, we learned that a federal judge actually blocked this notice from going into effect in 20 states that had sued the administration for this notice and for the radical reinterpretation of of a term in a law that had been consistent for 30 years. So in 20 states, this notice has been blocked. We don't know exactly what that's going to mean in the future, but for now, it's a temporary win. So groups in these states will not be able to, this new notice will not apply to those groups, or those states rather. Okay, now we're going to go into food assistance programs and changes in those. Under HR 1, again, this is Congress. The bill ended SNAP eligibility for many lawfully present immigrants outside of those immigrants listed below. And so similar, if you remember that other slide where we crossed out all the immigrants that are no longer going to be eligible, those apply here too. The implementation guidance remains unclear, and we expect more guidance on when that will take effect by 9/30 or September 30th. Another change that is general, but and not just applicable to immigrants, is that it increased the people who are subject to certain work requirements. So I don't think I have that here, but that's not specific to immigrants, but something that I had mentioned earlier. Okay, so that was Congress. Now, the USDA, U.S. Department of Agriculture, issued a similar notice on federal public benefits in July. And this confirmed that school breakfast and lunch programs must remain available for all children, regardless of their immigration status. It confirmed that states have the option to deny certain food and nutrition programs to immigrants who are not qualified. This was not a new option, but they just restated it. And then it also suggested that recipients of certain grants and licensing by USDA are receiving a federal public benefit and must follow the list of qualified immigrants who they can serve. So this gets a little bit tricky, though. I'll say that this one was not as expansive as that. This notice did not add programs to their list of federal public benefits. It just mostly reiterated and caused some additional confusion, because it's saying that certain recipients of grants, like a nonprofit, would now need to no longer serve groups outside of the qualified immigrant status. But then it also says that if they're nonprofits, then they don't they are exempt from following this piece. So it's a little bit unclear and confusing. And then finally, we have the child tax credit. So currently, children who have Social Security numbers can receive the child tax credit, even if one or both of their parents use an ITIN, which is an individual taxpayer identification number, to file taxes. Now, effective after this year, so in tax year 2025, this bill made permanent the 2017 exclusion of I-10 children's access to the child tax credit. So now children whose parents have I-10s will no longer, even if those children are U.S. citizens, their parents will no longer have access to the child tax credit. So at least one parent of these children will have to have a work eligible Social Security number to claim that tax credit. And this is, we anticipate this will affect more than 2 million U.S. citizen children nationwide. Okay, so how do we move forward from all of this? PIF has 6 working groups right now through which we structure a lot of our advocacy work and campaigns. And there's going to be several challenges really facing us, right? As we respond and try to gather the pieces of so many things that have been taken away and shattered. So we have a community education group through which we develop community-facing materials and resources, and we have a lot of partners who are on the ground who participate in this and help us see what they are witnessing firsthand, and collaborate in developing resources that can be helpful as we reach immigrant families. We also really want to be able to document the harm and demonstrate the impact that these changes are having and are going to have on our communities. And we'll be doing that through the research working group. We're talking more about that. Then we have the NERS working group, or the policy legal, which is really the group of folks who get into the weeds, into the real weeds of policy, who will be continuing to monitor and educate about implementation of these changes, because right now things have been approved or passed, but we still are waiting to see how implementation is going to take place. Finally, our federal advocacy working group is going to be, continuing to strategize and think about ways that we can both repeal some of the changes that have been made through Congress and also undo some of the administrative actions. And our communications and narrative working group are going to continue also making noise and thinking about ways that we impact that dominant narrative of not just one that is anti-immigrant, but also anti-benefits. And then finally, our state policy working group really brings together state partners to think about how to mitigate the harm that these policies are going to have at the state level. Also, though, in the context of just a hostile environment in states as well. So I think that's about it for me. Thank you so much. I believe we do have time for questions, and I'm sure there are some, right?
So first off, Letizia had asked whether you were going to send out the slides, and you did say yes during that. So if you can send them to me, I can send them out to everyone on the email list. And Patricia Bedford had asked about, I think it was the last slide when we were still under Medicaid healthcare issues, whether something was blocked in New Hampshire. I don't know if Pat can specify, but that was the one question.
I can look that up momentarily.
Yeah, you said there were 20 states that were affected by the lawsuit. I just wanted to know if New Hampshire was one of them.
Yes, let me.
Thank you.
I'm looking that up right now. I don't know if they were in the list of states who filed this lawsuit. And I actually don't know if I can look this up quickly, but I will follow up and let David know so he can let you all know as well.
Awesome. And one of the things was a lot of this was national, and I know that there are state level administrative changes or whatever that are possible. I know that Joe had put something into the chat about something that was going on. I don't know if I can find it now. that was different on how it was being administered here in New Hampshire. Oh, here we go. Update from adult education classes will now screen for citizenship, immigration status to determine eligibility, which has previously not been the case. They're waiting on guidance now for how that will be implemented for the new state leadership. So it's interesting because not only do we have stuff being pushed down from the federal government, then it's how it's interpreted by the state as a whole, but then it's also how it's actually administered can always be an issue. So um, for example, along driver's licenses, we just had an issue that people are supposed to get, if they get a refusal, they're supposed to get 540-day extension. People were going in with that, which meant that they were still eligible for a work authorization or a work documentation, but the DMVs at local DMVs weren't allowing that. So it's an issue that's being worked out, but there's just so many levels.
So many levels.
I did have another question. When in a lot of your charts, you said that people that weren't affected or that were still going to be able to be covered was, I think it was Cubans and Haitians, but isn't I can't keep track. Haitians were going to lose their TPS status or protective status in September or October. Did that get pushed out to February? And I guess that's my main point, is that they can change these things at any time for a group, right?
So I believe there are, and I'm not an immigration lawyer, but I believe there's both Haitians with temporary protected status, and those who have a Cuban Haitian entrance status. I'm not sure if it's the same thing or not. So I'm afraid I won't be able to ask or answer that specific question about
Okay.
that kind of immigration law piece.
David, I think you're correct.
Oh.
The temporary protective status currently, for Haitians at least, will expire early next year.
And that would be for everybody.
That's my understanding. The Trump administration had tried to set that date in August. Courts barred that and said that the change was not managed properly. So I don't know if they can change it at any time, but they have, and it's ugly.
Yes. Other questions?
I'm just a little bit, we had many Haitians that were under that temporary status and they lost status this year. They even lost their jobs. So that means that just part of people, Haitians that were under the temporary status lost their status at sometime, it was sometime April or May. So not everyone from Haiti lost it at that moment.
So that was a case by case by their asylum applications?
Okay, thank you.
Oh, I don't know. That was more of a question. Sorry.
Okay.
Does anyone know more of that?
I didn't really hear the full question, but all of these things depend on when people arrived and exactly how they arrived. And they may all be Haitians, but they may have quite different conditions right now. We're aware of a woman from Manchester who was attempting to move to Canada and was detained at the border and then deported to Haiti with her very sick infant son. So, it depends on who they are and how they got here and where they are now.
I think what this really highlights is just how so many policies at various levels, state level and federal level and even local level, are really colliding and making this even more confusing than it already is, right? Because then we have individual situations and case by case basis, and then we have these laws that will apply to everybody. And then we have some notices and lawsuits that are blocking some things in some states and not others. So it does get really messy. We try to provide the latest information and explainers as we have it. So in the presentation, you'll have links to those. And you all are also welcome to reach out to me if you have a question that we might be able to answer or that we might have a resource for.
So I think Wanda was just saying that during, I think April and May, they saw a lot of Haitians lose their status, and was maybe was it was more of a statement, but also whether what it was due to. Other questions? I was just going to share links to several of the documents. Oh, sorry. Go ahead, Savitri.
Sorry, I don't really know if this is like a question that anyone can answer, but I was just thinking as I was absorbing what Esther was sharing, is there like a strategy in place around simultaneously advocating to try to get like protect I don't know, try to get these like benefits back for immigrants and protect immigrants' access to public funding? Is there like a strategy for like combining that with finding like private funds and like fundraising, I guess? I don't really know. It seems kind of like, as I say it, it sounds kind of wild because it's like, how could you raise enough private funds to help people in that way? But I guess I'm just kind of, I don't know.
I mean, I think that's a great, it's actually a really great question because a lot of our partners and communities on the ground have really had to start thinking about, okay, access to these things are going away. And even for people who might still have access, many people will decide not to actually receive these benefits, even if they are eligible, right? For fear of enforcement. Or deportation. So, one of the biggest things that these changes are causing is what we know as a chilling effect, right? So that it not only makes certain people ineligible, then it creates fear among people who are eligible, and it just really will paralyze folks and say, we're not going to access any of these services. And so one of the things that many groups on the ground are thinking about are developing mutual aid and mutual aid support networks, right? Where we think about how can we provide different structures or create different structures to support people and to meet their needs under this hostile environment.
Sorry, Savitri, does that answer your question?
It does, yeah. Thank you.
Pat has just put into the comments, what are people doing in New Hampshire to address the fact that many of our families would be without SNAP and need food? That's, I guess, kind of a general question to the group. If anyone, I think that's a huge question, Pat, and we're all, Rick?
Well, New Hampshire state law requires that municipalities are responsible for emergency care. If people, theoretically, if you're poor, destitute, you can't afford heat, this town is supposed to provide it, and food, and housing. And obviously, what we're talking about with the changes in federal law is massive numbers of people no longer being able to afford any of it. And the burden theoretically will fall on municipal government to provide and hospitals to provide that service themselves. And we all know that's not going to happen in New Hampshire. And I think we are facing an enormous crisis, financial crisis for people, not just immigrants and refugees, but for anybody who's low income in the state and for the municipalities where they live. I know that in Manchester, many of the human service providers are trying to work together on a strategy to deal with that, the defunding of Medicaid and SNAP. I don't think they've come up with very good answers yet. And so I think we should all be preparing for that a wave of sadness and misery that no one's prepared to deal with.
Thank you, Rick. Pat, I'm thinking, is it Kathy or Karen? Karen, I think, that comes from the city of Concord to your Pat facilitates the Concord Area Providers Group. And there was a woman from the city that would come, and she struck me because in describing herself, she's like, she has to provide this information regardless of what her budget is. So I think that she goes above her budget.
Karen, it's Karen
Karen.
Williams, yeah. Kathy Kitchell and I had really good success this summer connecting Essentia to the gleaning program. If anybody is interested, it was through Merrimack County. We added a stop where they donate food from farms to include Essentia, and it was really successful for those of you who are out there. A lot of farmers leave their food in the fields, and I was able to work with Merrimack County to have our immigrant refugee population be a place that is donated the food to. So Kathy was wonderful, and it really worked really well. If anybody's interested, you could reach out to me or to Kathy. And I think it's continuing, Kathy, isn't it? Yes.
Yes.
Great.
Angela Zhang was talking about spinning up some more mutual aid in the Upper Valley region, so people might want to reach out to her too. And I just wanted to recognize Martha's got her hand up. And then, Angela, if you want to add afterwards any information about what you're doing, that would be great. Martha?
And I'll let Angie talk specifically to some of the things that we're all trying to do in the Upper Valley. I wanted to respond to both what Rick and Patricia were just saying about the state requirement that municipalities serve people in need and have a way to do that. And they have to go above they have to go above their budget if they are going to serve people. If they're asked for money and they don't have it in their budget. And I actually wonder if so lots and lots of people don't know this, that every single municipality in the state, that's a requirement of the municipality. And I actually wonder if one of the strategies is just making sure we're putting in those applications. We're actually making sure that every municipality is made aware of the people in their community that are in need and how they're in need. And putting some pressure on those. We know our municipalities don't all have the money, but then they'll at least be aware. And then they can reach out for their own communities to help them meet needs, which is sort of one thing that happens. But I think we say, oh, theoretically, but it's actually a thing that's, they have to do. And I'm just wondering about that as again, sort of an advocacy strategy to generate some awareness. And in some communities, they do have a budget and then nobody asks for it. So anyway.
Absolutely. I'll just note, Pat, that Esther put in that New Hampshire is not one of the states who sue the administration. So it's not blocked in New Hampshire. So she did get back to you on that. I did want to, now I forgot what I was going to say, but so I don't know, did Angie have anything she wanted to put in?
Sure. I think one thing I just want to quickly say is that I worked with a lot of local welfare officers in our rural-ish area, and the level of training, the availability of municipal offers varies wildly from town to town. And that might have to be a case by case basis of is this person friendly for immigrants? I'm worried about a chilling effect there. So I think it might just have to be a lot of local outreach, Martha. I did make the mention of a mutual aid. I think I need to learn a lot more about mutual aid. I would love to know if other folks are doing things there to build this up because, as part of the BIPOC community here, I think we are concerned, are we going to be shut out of these programs and how will we be able to, sort of take care of ourselves? But I actually don't have a lot of experience in mutual aid, so I'd welcome other people's knowledge on that.
Awesome. What I remembered, what I was going to say before for Martha was that I attend the New Hampshire Hunger Solutions, and a lot of the times one of the things they say is that SNAP and all the other benefit programs are a fraction of the people that are eligible are actually taking advantage of these things. So that is an excellent strategy is to try to make sure that people are made aware and to assist them signing up for this. I see Karen, and I'm sorry I missed you before, and I didn't mean to speak in your behalf or anything. I hope it did, but please, you're the expert, so tell us more.
Hi, unfortunately, I've been dealing with other things, so I'm looking at the chat. I said, "Oh, I see local welfare." Okay, so here I am. For those who don't know me, my name is Karen M. Williams. I am the Concord Human Services Director. So I do actually local welfare for the city of Concord. I've been doing this work. I started in Nashua, and now I've been doing this in Concord for several years. So every city and town in New Hampshire has a local welfare department. And Angela, I do agree with you that there are agencies, there are, especially in smaller towns, that we work very differently, and we shouldn't, because we all have the same statute. So we are under statute RSA 165, where we are mandated by law to assist any poor person who's unable to assist themselves, and that's with their basic needs. So things that we do here is rent, food, shelter, utilities, indigent burial, and prescriptions. So those are kind of the basic needs that an individual needs. With all the changes that is going to happen at the state level with the food stamps and Medicaid, there is going to be this trickle down effect that is going to be occurring, unfortunately. And you're right, it's going to be a lot for the municipalities. And we do need to work creatively and collaboratively in order for us to no offense. I think we need to say it. One thing about me is I am transparent. We do not all work together. We work very differently. And I think that's part of the frustration, right? We do have communities that are saying that they run out of money. We, as a municipality and doing welfare, local welfare, they cannot ever say that they run out of money. By law, they have to have that money. And they have to get that money. So it does become very frustrating for that. I'm going to put my name in the chat, because if you're running into that situation, I also sit on the New Hampshire Local Welfare Association as a vice president. So we can take this to our executive committee, which I'm having a meeting pretty soon, and we can talk about these issues that when a person is coming in, they have the right to apply. They cannot be denied an application. If they are unhoused and in their community, you're mandated by law that you have to attend to them. So we all have basic policies, and every community must have guidelines on how they implementing local welfare. Some smaller towns may have one community maybe also being the overseer for several others because they're just so small, and that's fine. The person must have this access to their application to do that. In our office, we're full-time, so the person just can come in and have, apply and things like that. But no, this is something that we're taking very seriously at our association, of saying that we need to spread the word, and people need to do their job at the end of the day. We cannot continue to doing what we are doing. Sometimes can it be frustrating? Well, sure, but we also have policies and procedures that we have to do. It's not always easy, the process, but I respectfully say we all have policies and procedures that we have to do, right? And sometimes that could be very frustrating when we're working with an individual that may need certain things. But again, if you run into any issues, please let me know. And you're right, it is going to be a lot. I have a small office of, I have 3 caseworkers, an intake worker, and myself. And if we have a lot of applicants, there's going to be a lot of frustrations with a lot of our clients if they can't get in immediately. We are going to be having to push some of our appointments out further. So yes, that's going to be difficult. So I'll put that. I do see one question in the chat. Let me see if I can answer that question. Hold on. I think yes, it does. So right now in our what it says, it's complicated, right? There's some language in our guidelines that says if you are not if you were here undocumented, that it makes it a little bit more challenging to be able to do that. A person should not be denied the right to apply. But I think it makes it difficult for some of these things. If a person needs medication, then our office usually is right away doing what we need to do. But this is a hard one to explain. If I have any of my New Hampshire legal assistance friends online, I'm pretty sure that they'll say, have a person apply, which they can. But yeah, it makes it difficult. And I think that if some of these laws do come to pass, how much more difficult it's going to be. If a person is sponsored, that they came here sponsored, we can look at them to have the support go back to the person that sponsored that family because they are responsible for the first 5 years. But yes, any other questions? I don't want to overtake the meeting at this point in time that I can answer really quickly for anybody. Any questions about welfare that I can tell them? No, we don't share. That's always been if there is a release of information, so I can never say never. So in my work in Nashville, there were a lot of individuals, legal residents that are going to be going through their citizenship. I've been doing this for 20 years. I have never been approached by law enforcement or anything else to say, have that person applied. If they have the proper documentation for us to release it, I can't say that I can't release it either. I have never had that experience in my career, especially working in two different communities. Does not mean that I can say for sure if a person applies that we're not going to do that. With everything that has been happening with ICE, I have not had that experience that they're coming to my office and tell me who that is. We already have a process with the city that you're going to have a warrant in order for you to be able to do that and going through that process. We're not playing that game here in Concord. So that's been very clear. They're going to have to go through our attorneys and issue those proper warrants if they have those type of questions or they want to do that. But I'm not going to sit here and say, absolutely not. That can happen because I don't know what people invent at this point in time, but there is a process that the city is going through in order for that to happen. Yes, Esther.
You're muted.
Thank you so much for that, Karen. And I did want to add a little bit of nuance to that. You're right that for many years there have been a lot of data protection, privacy protections around information that people submit to government agencies. The Trump administration has really attacked that privacy. And so we are seeing some agencies develop memorandums of understanding with other agencies like DHS with certain like CMS, for example, and requesting information of people who receive their services and such. And so some of those things are beginning to take place. There's also, of course, like, what's going to be the advocacy about that? Is there any way we can block that? For data privacy concerns, we do have I think it's a one-pager where you can kind of see what's happening and explain this data privacy concern to people that you work with directly to say, here is what we know. And here is how you can decide whether or not you want to continue accessing the services based on the facts. We don't want to tell people one thing or the other or what we think they should do. We want them to be able to make that choice, but to be able to make that choice in an informed way. And so this isn't specific to where in the area where you said, Karen, you're located. This is across the country, right? So I have to hop off, but before I do, I'm just gonna look up a link to that data privacy one pager that we use for folks to specifically as they're interacting with individuals who have these concerns.
And does anyone have any other questions for Esther before she pops off? Thank you so much, Esther. And you're still looking to answer a question. Oh, something's in the chat. Just another thank you. I did put into the chat, let me see if I can find it again, because part of what made me think to ask Esther to do this is the PIF did a huge presentation back in June or July, and I put in 3 documents that I got as, I think, a follow-up from that. Provisions on immigrant access to public benefits, an explainer of HHS notice and federal public benefits, and an explainer on USDA's notice on the federal public benefits. So that has some more information in it too. Plus, if you just go to pipcoalition.org, they have some other information as well. Esther did put in a link into the chat with today's slides, correct?
Yes, and then I just put 2 more links. One is, or actually it's just one. So yes, one is to that one pager on data privacy and public programs. And then in parentheses is the link to the web page with translations for this document into Arabic, Chinese, French, Haitian Creole, Korean, Spanish, Tagalog, and Vietnamese. So this is information about data privacy that you can share with communities that you're working with who are concerned about accessing programs for data privacy concerns. Thank you so much, everybody. It was a pleasure to be here.
Thank you so much, Esther. Big round of applause. Thank you. Thank you. Thank you. Awesome. There was something else I was going to say. Now I forgot what it was. But let's move on to updates for organizations. What are your organizations all working on? What events do you have coming up? What campaigns are you working on? What are you seeing in the world? Can anybody have updates for us?
So the National Multicultural Festival is this Sunday from 12 to 4 at the Nashua Public Library. It's also remote online. Arida, who's also on this line, might want to talk a little bit about it because she has done an excellent job trying to navigate this year. So I don't know, Arida, did you want to talk a little bit about it? But anyway, it's this Sunday. So go ahead, Arida.
She may have just jumped off. Arita, are you still here? I think we just missed her on that one.
Okay, so hope to see everybody there on Sunday. It's really fun. It's been great. Previous years, David was there last year, and I was so happy to see him. He did a great job outreach. So please try to make it this Sunday. Put it on your calendars, 12 to 4, the Nashua Public Library. It's worth the drive if you're coming far away. And bring children too, because it's really good for them to get that music and get different cultures. That really helps them. So thank you, everybody. Yeah. And thank you, David. This was good today.
Thank you, Donna. Irada did put the flyer in the comments. So just a remember for, or chat rather, everyone remember to if you go in the top now of the chat, there's the ... You can save the chat to save any of the information that people have put in. Tracy?
Thanks, David. So a couple of years ago, the various folks in the state sent out a survey. And well, not just a survey, they interviewed people around the state about mental health services availability in the state of mental health for the BIPOC immigrant and refugee community. And it probably won't come as a surprise to you that not in good shape. So there's a group of us, I just got involved with this. The endowments and Endowment for Health is involved, State Office of Health Equity, State Office of Health Access now, behavioral health and that, are trying to reach out to people in the community to see about what we might create from a community level. And we're inviting various community leaders to get together to talk about this, and you know, in regard to what some folks have talked about today, how can people in the community support each other, and more specifically around mental health issues. So on November 13th, the Suicide Prevention Coalition is going to host a conference on suicide prevention in the morning, and the mental health professionals will go to that. That will actually focus on diversity and issues with suicide prevention. And then that evening of the 13th, this group that will host a separate meeting for community leaders and other people in the community, in the BIPOC and immigrant and refugee communities, to talk specifically about how we might create something both in Manchester and then later in the state, where people can support each other and deal with some of the mental health issues, and also just deal with the craziness of trying to handle all the stress from ICE and all that's going on now. So any of you can contact me about that. I'll put my information in the chat. But like I said, we're going to reach out. We've talked to various people in Manchester already, and we have some different BIPOC community leaders that are going to be part of this planning, because this, like I said, this is really just starting up. So welcome any input. Thanks. Oh, and if people want to attend on November 13th, sorry, David.
Tracy, do you have a flyer?
No, trying to put that together.
Okay.
That's part of a meeting next week, to start talking about that so we can get it out to people.
Awesome. Thank you. Is Jessica still here? Jessica is. Do you want to say something about the Concord Multicultural Festival coming up? Not this
Yes.
Sunday, but next Sunday?
Thank you, David. Yes, I am multitasking because my festival is next weekend. So yes, the Concord Multicultural Festival is Sunday, September 21st at Keach Park from 11 to 5. This year we weren't sure if we were going to have it, so we finally decided, I think in June, late June, early July, and have been scrambling ever since to get it done. But it is coming together. And our biggest focus is safety, as some of you in this group have been part of our conversations. We are doing all of the vendors and performances. The structure of the event will be the same, but our focus is on safety. So we've added some extra elements like GSOP is going to help us with active bystander rapid response training. We're going to have folks canvassing with know your rights information. We're going to have a safety booth where there will be like an EMT and also just like a place where people can duck out for a few minutes or ask for help if they feel unsafe. And we'll have tons of resources there. That's hosted by the 5051 group. ACLU will help with legal observers, and we'll of course have peacekeepers. We have a few private security folks there that the ACLU uses for their events, and we'll have one police detail officer whose family came here as refugees when he was younger. So he is somebody who gets it and understands what we're dealing with these days. So if something happens and it's going to be really devastating, but we're really working hard to make sure that we're doing everything we can to be safe. Otherwise, it's shaping up to be a beautiful day. As always, we usually have a really good turnout, and I'm looking forward to it because we have 6 hours of performances. We have like 75 vendors, lots of food, and it'll hopefully be a beautiful day.
Thank you,
Thanks.
Jessica. And can you put a flyer in the chat so people can share?
Yes.
Who else has updates? Cora had put in that there is a coalition that's formed up to try to get ice out of Pease. ICE is now using Pease as the New England central hub. They moved from Hanscom Air Force Base due to pressure from local groups. So check out what she has there. Next Tuesday is the next Peace Development Authority meeting, and we're trying to get folks out to that. So she just put it in again. Again, everybody, if you could put your events into the chat, that would be great. But and also please let me know what you got going on. John, do you have tickets saved for all of us for the Poutine Festival? That hasn't happened yet, has it?
No, the Poutine Festival's coming up on October 25th. I believe that we're all sold out, unfortunately, David,
They
but
always are.
we'll be there and celebrating. It's the t-shirts are getting bigger and bigger over the years, I'm afraid. At least mine.
Yeah, mine too. Any other events? Are you doing? You're doing cafes, conversational cafes, or anything? Or
We don't have any of that coming up immediately, perhaps in November. But what I recommend to people, if you have people that have an interest in French, maybe coming from a francophone country as immigrants, or just enjoy the French language, to check out FACNH. And I'll put that in the chat again. Franco-American Center, New Hampshire. We have a lot of different activities, and we try to keep the prices on most of them at a level that people that maybe don't have as much means available can still take advantage of some of the cultural opportunities that we have. So that's all I've got for today, David.
awesome. Anyone else? I'm sure that Rick, any events for BCNH or programs? How's your ESL?
Sure. I would just add, we're fortunate. We're expanding our ESOL programs. We've got particularly basic classes, which has been the biggest demand in Manchester for people who are at the very beginning of learning English. We'll be focusing a lot of our attention, particularly on women from Afghanistan, but others as well. So that's exciting. We've just hired a full-time person and two part-time persons with a lot of experience. And I want to go back half a step. A lot of the resources that we use to do our work and the other refugee resettlement organizations in the state are funded by U.S. Office of Refugee Resettlement through the state of New Hampshire. And the big contract that we used to do all that was surprisingly delayed at the Executive Council. We didn't really know why. But many of us did what we could to lobby to make that happen. And it did finally get approved by the Executive Council a few weeks ago. And I think that the piece that made it move was when the mayor of Manchester learned that if it didn't, the city would have to pay a lot more of its welfare money to support the services that we're providing. Not just us, but the International Institute of New England in particular. And the mayor called the governor and said, don't put these costs on us. Move that contract. And she did, and it passed. And so this is the conversation we were having earlier about the burden on municipalities due to the loss of these federal services is really salient for mayors and city councils and aldermen. And I think it's going to be important to move that political front as we go forward. Thanks.
Thank you, Rick. Just to throw out there where this isn't really a political advocacy thing, but if the legislature has to submit or the House anyways, has to submit their bills on the 15th through the 19th. So if you have any legislative House representative connections and you have ideas that you want to get put through as an LSR or pre-bill, basically, legislative suggested something or other, contact your legislator because they need to put those bills in between the 15th and the 19th. So I see, Joe, do you have any stuff that's coming up, or sorry to put you on the spot. I know you put something in earlier. Joe's not there. I did put into the chat that the Manchester, actually, Greater Manchester ESOL Providers Group has a website which is still being worked on as it's flying. But check that out. I'm hoping that it will go to be a statewide thing at some point, or we can use it as a template for other regions. But Courtney Perrin wasn't able to join us today because they're moving to a new location, the Center for New Americans, which I think they've actually changed their name. But that is something. Again, remember to copy your chat or save your chat so for a lot of this information. Martha Teka put something in about the 19th. September 19th, 4 to 6 p.m. in Lebanon, there's an event going on. Who else? Linda, Pat, what do you folks have things that are going on?
If I did, I'd tell you.
All right, anybody else? Awesome. Oh, Ileana, are you still here? Ileana, can you just share again? We've got Granite State Organizing Project is spearheading the rapid response program that's going on. So there are cards out there for if you see ICE to contact someone, and that's Ileana or someone else from GSOP. But I'll let Ileana talk about it. Sorry. Are you there, Ileana? Ileana's not there.
Sorry, I just missed the beginning of that. What was that?
Oh, I was just, do you want to say anything about the rapid response, the canvassing that you're doing, the court watch stuff that you're doing, basically the effort in reaction to the current situation?
Yeah, sorry, just a quick debrief of what's going on. So GSOP, with others, we actually have been doing canvassing in Manchester and Nashua, just to share know your rights information to the community members, and this includes business owners as well, and doing court hop watches. So they have been going pretty well. As of right now, we have put a pause on the Manchester canvassing. But we are starting the Manchester Courthouse Watch. We did have an incident that someone did got detained in front of the courthouse here in Manchester. So there is a new team of people who are actually going to be keeping an eye out on the courthouse. Um, as well, we all keep an eye out in the community and stay in contact with our leaders within the community just to know like what's going on, if we've gotten any updates. Um, so all of that has been going on. We still continue to do our rapid response training, our active bystander training, and our Know Your Rights training. And our hotline number is still active. We're still sharing that. The teams are still up and ready to go whenever there is that need. So please keep sharing the information. And if you have any questions or any concerns, please feel free to reach out to us.
Awesome. Thank you, Ileana. Deborah Pramala, what's the Disability Rights Network working on? Any updates?
Well, we're getting out there. There are a few towns that have municipal voting, so we're working on voting, and we're gearing up for the big election next cycle coming around.
Right.
But we're still connecting with the immigrant population and community, especially trying to get their rights, knowing their rights around if you have an individual who experienced a disability and is being discriminated against because of their disability, you can contact me and I can put you in touch with the attorneys.
Right. Awesome. Thank you, Deb. Which makes me remember also that I'm part of two groups, what are previously called digital equity groups, but now they're digital access groups in Nashua and in the Seacoast. And I've been reaching out to the Manchester and the Monadnock and areas, and then hope to go beyond that, just because the intersectionality, like just Deb made me realize it again, that we are so intersectional with so many other areas with the folks in the disabilities community, but also little things like digital access. Digital access affects healthcare, education, ESL. I have heard people say that a lot of folks come back to do ESL classes because they feel like they're disconnected from what's happening to their kids in their schools. So there's just so many intersectional areas, and unfortunately, to do anything, to pay your bills, to do whatever, you need to have digital access, which there's a whole spectrum from just do you have Wi-Fi in your neighborhood or internet in your area to do you have a machine? Do you know how to use it? And do you know how to use it correctly, I guess? And then cybersecurity, et cetera, too. So if you are in Manchester or the Monadnock region and would be interested in helping to start up a digital access, which used to be digital equity, please contact me. Sorry, I'm just reading. Subaru put on the Baha'i Community of Greater Concord. We'll have a booth again at the Concord Multi Festival. That's good. So that is going to be a great intersectional connection between all of us at this multicultural festival. Any other updates? Please feel free to always reach out to me. I need to reach out to all of you and talk about what's going on a regular basis. I'm just trying to make these connections and keep them up. There's just so much going on these days. But thank you all for being here today. Anybody else? Awesome. Well, thank you. I'll give you 6 minutes of your time back. I hope that this worked out. Please do the survey. Please save the chat. And thank you for all coming today. And again, feel free to reach out for me if there's anything I can do to help or if you have any questions. Thank you all.
Thank you very
Thanks so much, David.
Thank you.
Thanks, everyone. See you soon.
Thank you. Ooh. Oh, Gail, I should have asked. Sorry. I know you have a lot of stuff going on with solidarity and labor. Labor and employment is another whole issue that intersects with immigrants and everything else. Thank you, everybody. I will close out. I was just waiting to see if anybody had any other last questions. Have a great day.